Hello guys, welcome to Fast Coder 21 free medical coding YouTube channel. So basically we are creating this video for only members, and in this session we are going to learn orthopedic surgery coding episode 1. So here we will follow our CPT coding book, and also we will use Codify in order to understand very easily. So as all of us know, musculoskeletal system starts with 20,000 1002 2999. So basically we have multiple procedures in orthopedic system. So here if you see here general 20100 to 20999. These are general procedures. So basically general procedures means these procedures will be performed on all the body parts. So that's why they have mentioned it as general procedures. So here first we have incision. So for incision 20100 to 20103, and we have wound exploration, and next we have excision, next introduction or removal. So you don't need to worry. So after completing this anatomy section or these guidelines, we will learn code by code. So in order to learn orthopedic surgery coding, you need to have good understanding of anatomy. So here you no need to worry about anatomy also, just you need to check your CPT book. Sometimes CPT is not available in your CPT book, you can use Google. So for example, if the patient like physician is performing procedure on maxilla, but you don't know where is maxilla. So if you see in the anatomy chart in the CPT book, you can understand that maxilla in the face area. So if you see here, maxilla is the top portion and mandible is the bottom portion under the teeth. So next we have cervical vertebra, first rib, scapula, sternum, clavicle, humerus. So this is the humerus. So otherwise we can call it as shoulder. So why means it is in the shoulder area. So next we have radius and ulna, carpals, metacarpals, and we have lumbar vertebra. This is the ilium part. This is the sacrum, pubis, ischium, and this is the femur, hip area or thigh area. So and also we have patella. So usually we'll call it patella is in the knee area. Okay. So next we have tibia and fibula. So next we have tarsals, metatarsal and phalanges. So whenever you have musculoskeletal system procedure, as soon as you see the operative report, you need to check the anatomy of the procedure performed. So you no need to worry while doing our like scenarios, we will learn all these things. Next we have skull frontal view, skull lateral view. So most of the time we will not code from this area. So if you code also, just you need to know anatomy from here. Everything is available here, so you don't need to worry about anything. So next we have thoracic vertebra. So superior view. So thoracic vertebra means it is the thoracic area spine. So we have spinous process. So whenever you see spinous process, you need to understand that it is on the back side of the patient. So this is the anterior portion. This is the posterior portion of the spine. So this is lamina. This is the spinal canal. From this spinal canal, spinal nerve will enroute. And we have transverse process. Here transverse costal facet, superior articular facet, superior costal facet, and this is vertebral body. So this is the pedicule. So vertebral body means combination of all bony structures. So if you see here, this is lumbar vertebra. As you need to understand that these body parts are different for each and every spine. Okay. So here we have lumbar vertebra. Here we have lumbar vertebra lateral view. Okay. So this is the vertebral body. So basically all bony parts of the spines we will call it as vertebral body. All soft part of the spine we will call it as intervertebral disc. This is the soft material. It will act as a cushion between two vertebral bodies. So this is the intervertebral disc. And we have spinous process, inferior articular process, inferior vertebral notch, intervertebral foramen. So this is the foramen. So this is the superior vertebral notch. So you don't need to worry about these things. So while coding or while learning all these procedures, we will learn. So here also we have replantation, grafts and other procedures. And we have head. So you need to remember that in orthopedic system, we have codes are divided based on the top to bottom. So here, as all of us know, head is the top portion of the body. So bottom portion is our toes. So we will start with toe head and we will end with toes here. So in head also we have incision, excision, manipulation, head processes, infusion or removal, repair or revision. So basically these are common for all the body parts. For example, neck also we have incision, excision, repair, fracture and other procedures. And back and flank excision. So and we have spine also. So we will learn during our training the spine also. You no need to worry. Okay. So in spine we have incision, excision, osteotomy. So we will learn each and every code during our sessions. So this here we have abdomen. Next we have shoulder area. In shoulder also we have incision, excision, introduction, removal, repair, revision, fracture, dislocation, manipulation like those arthrodesis. So here we have humerus. So usually we will call it as upper arm is humerus. So there we have shoulder area or shoulder joint forms and elbow. So in here also we have incision, excision, introduction or removal. Again we have after humerus we have forearm and wrist. Okay, here also we have incision, excision, introduction or removal, repair, revision or reconstruction. So during our session we are going to learn meanings of what is incision, what is excision, what is introduction or removal, what is repair, revision or reconstruction, and also bones, muscles and tendons of the hand. So as all of us know, we have most of the procedures, same day surgery procedures are depends on hand and wrist area also. So whenever you code hand and wrist procedures, you will see all these bones, muscles and tendons. So these are very important in order to code properly. So here also hand and fingers, here also same procedures, incision, excision, all the same. And here we have pelvis and hip joint. So incision, excision, introduction and removal. Here also same, see here, incision, excision, introduction or removal. Femur also same procedures. Leg also, leg we have tibia and fibula, and also we have ankle joint. So these are the same. So here we have bones and muscles of foot. So in order to code foot procedures, you need to understand these bones and muscles properly. So you don't need to worry, we will learn easily. So next we have foot and toes. Next application of cast and strappings. So here these are for body and upper extremity, these are for lower extremity. Then we have removal and repair of application of cast and other procedures. Next we have endoscopy or arthroscopy. You need to remember that arthroscopy is also one type of endoscopy. Okay. So here we will complete this index. So now we will learn each and every code. So here also we have few muscles. See here, for example, if you see here, pectoralis major muscle. M means muscle. Latissimus dorsi, M means muscle. Serratus anterior, M means muscle. So these are all the muscles. So in order to learn any type of surgery coding, you need to master your CPT book first. So these are the muscles like situated on the back of the body. So now we will learn musculoskeletal system. So all services that appear in musculoskeletal system section include the application and removal of the positive cast spleen traction device when performed. So what is the meaning of this? So whenever physician performs any procedure, initial cast, splint and traction devices are included in the musculoskeletal system procedure, which are usually 20,000 series codes. So we will not code initial cast, splint or traction device. Supplies may be reported separately. Okay. So if a cast is removed by someone other than the physician or other qualified healthcare professional who applied the cast, report a cast removal code. So what is the meaning of this? So for example, physician A applies the cast or splint. If the physician B removes the cast or splint, we need to code 29700, 29705 and 29710. And we have one more guideline: subsequent replacement of cast, splint or strapping and or traction device during or after the global period may be reported separately. So here you need to understand that, for example, patient has cast applied. So as all of us know, initial cast we will not code. So as patient has any type of fracture or damage in the cast, patient will come into the hospital in order to replacement. So here they are telling that subsequent replacement of cast, splint or strapping we can code, which is occurred even during the global period or after the global period also. Here we have one guideline. A cast, splint or strapping is not considered part of the preoperative care. Therefore, the use of modifier 56 for preoperative management only is not applicable. So basically, cast splint application is not included in the preoperative care. So we will not use 56 modifier for preoperative management only here. Next guideline: codes for obtaining autogenous bone grafts, cartilage, tendon, facial autografts, or other tissues through separate incision are to be used only when the graft is not already listed as part of the basic procedure. So whenever you code musculoskeletal system procedure, you need to check the code description. If the code description is having with or without graft, we need to use that code. For example, if you don't have CPT code with any type of graft, you need to code the graft separately, where you need to check whether physician has performed separate incision for the graft or not. If the physician performs separate incision in order to create graft or harvest the graft, we need to code it separately. So only here our keyword is separate incisions. So you need to understand this word, separate incisions. If the physician harvests separate grafts using separate incision, we can code. If they are in the same incision, we will not code graft harvesting. Next, we have guidelines related to fracture and dislocation treatment, fracture or dislocation treatment. So for this both fracture and dislocations, we will use these guidelines. So fracture and dislocation treatment codes appear throughout the musculoskeletal system section that we will see. These codes are categorized by the type of treatment. So close, as all of us know, we have closure treatment where physician will not open any fracture site, and we have percutaneous, and here in percutaneous process physician will use the imaging system and he will insert or even apply pins or rods using the imaging guidance. In open procedure, physician will first create the incision, then he will go into the deeper tissues. So here you need to remember that for closed reduction, closure fracture repair or dislocation treatment and percutaneous fracture or dislocation treatment, physician will use imaging guidance. For open procedures, physician will not use any type of imaging procedure. So fracture scores are divided by the treatment, whether it is closed, percutaneous, open, and type of stabilization. So fixation, immobilization. So how does the physician will perform stabilization? So stabilization means like or rectifying the dislocation. So we have very important guideline. There is no coding correlation between the type of fracture or dislocation open and the type of treatment provided. For example, a closure fracture may require a open treatment. So here you need to understand that we have open, closed and percutaneous procedures. So there is no correlation between fracture type as well as the fracture treatment. For example, patient has a closure fracture. Okay, so in closure fracture, we can't see the fracture site using our naked eye. So if it is complex fracture, using the closed or using the imaging guidance, physician will perform the open treatment. So if you see here, a closure fracture is defined as a break in the continuity of the bone which does not communicate with the outside of the body. So basically in closed fractures, you will not see the bone outside. Okay, what they are telling here is for these closed fractures also based on the complexity of the closure fracture, physician will perform open treatment of the fracture. So for example, patient has open fracture. Even though patient has open fracture, based on the fracture type, physician will perform closure treatment. Next we have fracture dislocation treatment definitions. So these definitions are very important in order to understand the musculoskeletal system fracture repair. So here we have manipulation. Reduction by the application of manually applied forces or traction to achieve satisfactory alignment of the fracture or dislocation. So in manipulation what happens? So basically manipulation and reduction are both are synonyms. So you need to remember that if the documentation contains reduction, you need to understand it. It is manipulation. So during the manipulation process, physician will apply hand force. So he will use the hand and he will align the fracture site. We have one guideline here. If satisfactory alignment like reduction, so here physician has performed the hand force and it reduces the fracture. If that reduction is not maintained and requires subsequent reduction of a fracture or dislocation by the same physician or same qualified healthcare professional, append modified 76 to the fracture or dislocation treatment code. So first time physician has performed the reduction, but that is not successful. Again, if the physician performs subsequent re-reduction of a fracture, we need to append 76 modifier. So now we will check what is 76 modifier. So see here, so modifier 76 defines a repeat procedure or service on the same day by the same physician or other qualified healthcare professional. So whenever same physician performs repeat procedure, we need to use 76 modifier. So now we have completed manipulation. The important thing you need to remember here is manipulation and reduction both are same. Okay, if the documentation contains manipulation, you can take reduction code. If the documentation contains reduction code, you description in the CPT code reduction, you can take manipulation code. So if the fracture reduction is not satisfactory, if the physician performs subsequent re-reduction, we need to append 76 modifier, which we have seen 76 is for repeat procedure performed by the same physician. Okay. So next we need to check traction. The application of a distracting or traction force to the spine or limb. Skeletal traction includes a wire, pin, screw or clamp that is attached to the bone. Skin traction is application of force to limb using strapping or device. So we will check the difference here. So the application of distracting or traction force to the spine or limb. So we will check here in the Google. So if you see here, basically traction means pulling on part of the body. So basically it is pulling the part of the body. So if you see the difference, skeletal traction uses a pin or wire or screw inserted into the fractured bone to which a weight is attached. Okay, the weight will then pull the broken bone into place over time. So skeletal traction means physician will use pin, wire or screw into the fractured bone and automatically that and weight is attached to the fractured bone. So that weight will align the fractured bone. So whereas in skin traction, physician will not use any type of pin. Instead, he will use splint or any adhesive. So we will check the images. So if you see this one, this is the traction. Okay. See this one. This is the what is this? This is the skeletal traction. Why means physician has inserted pins into the bone and he applied weights here. These are the weights. So this is skeletal traction using the pins or screws. So this one is skin traction. Here physician will applying weights on the fracture area using the cast or splints. So next we will learn closure treatment. The treatment site is not surgically opened. So it is not exposed to the external environment nor directly visualized. Here The treatment site is not surgically open. As we have discussed previously, closure treatment contains physician will not open the fracture site here. Okay. Closure treatment of a fracture or dislocation may be performed without manipulation or with manipulation, with skeletal traction and or with skin traction. So during closure treatment, we need to check physician has performed any manipulation or not. So if the physician has performed manipulation, we will code reduction, CPT code, description code. So now we have, so basically what is closure treatment? So here fracture site is not visible to the outside environment. So next we have casting, splinting or strapping used solely to temporarily stabilize the fracture for patient comfort. It is not considered closure treatment. So what happens sometimes patient will come into the emergency department. So as soon as the emergency physician sees the patient, he will apply cast or splint. So what they are telling in the CPD guidelines, so temporary application of cast or splint or straps is not considered as closure treatment. It is not a definitive treatment. So this is a temporary treatment. So most of the time definitive treatment is performed by the orthopedic physician. So next we will learn percutaneous skeletal fixation, treatment that is neither open nor closed. So as we discussed previously, percutaneous skeletal fixation does not include any open or closed treatment. In this procedure, the fracture fragments are not visualized, but fixation pins or screws is placed across the fracture site, typically with imaging guidance. So as we have discussed previously, here fracture fragments are not visualized, but pins or screws are fixed on the fracture site using the imaging guidance like fluoroscopy or any other type of CT. So now we will learn about open treatment. So whenever you code up orthopedic system procedures, we need to know all these guidelines. So that's why I am explaining here. So we know now closure treatment. So in closure treatment, fracture site is not surgically opened. Okay. So and fracture is not exposed to the environment, outside environment. In other terms, in treatment wise, fracture site is not visible outside. In treatment wise, so here physician will not create any incision on the fracture site. So we have learned percutaneous skeletal fixation. As we have discussed, it is open or closed. So basically using the imaging guidance, physician will apply pins or screws. Okay. So next we have open treatment. So the site is opened surgically to expose the fracture or dislocation to the external environment for treatment. Or the fracture dislocation is treated through the traumatic wound or an extension, therefore, as is treated with an intramedullary nail or other internal fixed device placed through a surgical exposure that is removed from the fracture site with or without direct visual. Okay. So here the site is opened surgically to expose the fracture dislocation to the external environment for treatment. So basically in open treatment or open fracture, here physician will create incision at the fracture site. And if you take fracture, so open fracture means here fracture will visible outside to the external environment. So most of the time here in open treatment we will see ORIF, so open reduction and internal fixation. You need to remember that ORIF procedure will be performed in the only in open treatment procedure. Here physician will open the fracture site and he will reduce the fracture using the any type of intramedullary nail or any other types of like internal fixation device includes pins or screws with or without direct visualization at the fracture site. Next, we will learn external fixation. So the use of pins or wires that penetrates the bone and interconnection devices for fracture dislocation treatment. So basically, so external fixation devices are the device which are applied on the external surface of the fracture site. So physician most of the time physician will use these treatment external fixation device in order to treat fracture or dislocation. So external fixation device may be used for temporary or long-term fracture dislocation treatment. Okay, so they will be used temporary or permanent. So uniplanar external fixation places all the pins in approximately the same plane, but may also include triangular fixation across a joint. So here just uniplanar means one side of the fracture site. Multiplanar means multiple sides of the fracture sites. So we have one important guideline here. Codes for external fixation are reported separately only when external fixation is not listed in the code descriptor as inherent to the procedure. So always whenever you want to code external fixation device, you need to check the code description. If the code description does not have external fixation device, you need to code it. If the code description have the external fixation, you no need to code external fixation device CPT code. So if you see here, this is the uniplanar external fixation device. So only one side of the fracture side physician has applied external fixation system. So if you see here, so we have multiple sides. This is multiplanar external fixation system. Okay, this is the fracture. So our defect. So these are the external fixation systems. So here we have one important guideline reporting fracture and the dislocation treatment codes. So the physician or other qualified healthcare professional providing fracture or dislocation treatment should report the appropriate fracture or dislocation treatment codes for the service he or she provided. So basically physician needs to uh, or as a coder we need to provide what the physician performed or what the physician included in the operative report. So if the person providing the initial treatment will not providing subsequent treatment, modifier 54 should be appended to the fracture dislocation treatment code. So for example, if the first physician A performed initial treatment and physician A is not performing the subsequent treatment of the fracture. So that time we need to append 54. If the other if physician B performs subsequent treatment, we need to apply 54 modifier for the physician B procedure. So if a treatment of a fracture is defined above not performed, report an evaluation and management code. If the physician is not performing any type of closure treatment, open treatment or percutaneous fixation, we need to use evaluation management code. Okay guys, I think this week this is enough. So now onwards, I will provide you with every week one video for only members only. So whenever you have doubts, just mention in the comment section of that particular video.